In our golden years, we become diligent partners with our doctors, embracing routine checkups and medical tests as essential tools for maintaining our health. We trust these procedures to protect us, to catch problems early, and to guide our wellness path. But what if I told you that some of these very standard, very necessary tests carry a hidden risk, a subtle potential to increase the danger of a stroke, specifically for our seasoned bodies? This isn't about fear-mongering or questioning medical science. It's about empowerment. It's about transforming you from a passive patient into a knowledgeable, proactive advocate for your own well-being. Today, we're going to pull back the curtain on 6 common medical procedures and uncover how, under the right circumstances, they can create unintended risks. More importantly, we'll arm you with the questions and strategies you need to navigate them safely. This is the heart of the Senior Wise journey, blending medical wisdom with your personal life experience to achieve the best possible health outcomes. Part 1. The endoscopy enigma. When sedation lowers more than just your anxiety. Let's begin with a procedure many of us are familiar with, the upper GI endoscopy. It's a remarkable diagnostic tool where a doctor uses a thin, flexible tube with a camera to look at your esophagus, stomach, and the beginning of your small intestine. It's the gold standard for investigating issues like persistent heartburn, swallowing difficulties, or unexplained stomach pain. To ensure comfort, these procedures are almost always performed under sedation. You're given medication to make you relaxed, drowsy, and often you won't remember a thing. It sounds perfect, right? Comfortable and effective. However, herein lies the subtle risk for those of us over 60. The very medications that bring us comfort, the sedatives, work by relaxing our entire body, and that includes our blood vessels. As these vessels relax and widen, it can cause a drop in blood pressure. For a younger person with flexible, resilient arteries, this temporary dip is usually no big deal. Their system compensates quickly. But for a senior, the story can be different. As we age, our blood vessels naturally lose some of their elasticity. They can become stiffer, a condition known as arteriosclerosis. Furthermore, many of us have some degree of atherosclerosis, where plaque has built up inside our arteries, narrowing the passage for blood flow. Now, imagine this scenario. Your arteries are already a bit stiff and narrow. During the endoscopy, the sedative causes your blood pressure to fall. This hypotension, as it's medically termed, means there's less force pushing blood through your circulatory system. When that blood flow is reduced, especially to the brain, it can become dangerously low in those already narrowed vessels. If a part of the brain is deprived of oxygen-rich blood for even a short time, it can trigger an ischemic stroke. The case of Helen, a 72-year-old woman mentioned in the original video, is a powerful illustration. She went in for a routine endoscopy to investigate some digestive discomfort. The procedure went smoothly, but shortly after, she felt disoriented and weak on one side. A brain scan confirmed she had suffered a small stroke. Her doctors concluded it wasn't a random event. It was likely triggered by the drop in her cerebral blood flow during the sedated procedure. So, what is the lesson from this on our Senior Wise journey? It's not to refuse endoscopies. They are often vital. The lesson is to open a dialogue with your doctor. Here are the questions to ask. Doctor, given my age and my blood pressure history, what is my specific risk of hypotension during sedation? This shows you're informed and thinking critically. Is it possible to perform this procedure with a lighter form of sedation, or are there alternatives? Sometimes, a twilight sedation is used instead of general anesthesia, which may have a less dramatic effect on blood pressure. What specific steps will you take to monitor and manage my blood pressure during the procedure? Hearing their plan, like having medications on hand to raise blood pressure if it drops, can be very reassuring. Should I do anything special to prepare? Ensuring you are well hydrated before the pre-procedure fasting period begins can help maintain blood volume. By asking these questions, you are partnering with your medical team to create a safer experience, turning a standard procedure into a personalized one that respects the unique physiology of your body. This is a crucial first step in mastering your life health after 60 seconds. Part 2. The Holter monitor paradox, a device for the heart that can stress the brain. Next, let's discuss the Holter monitor. This portable device is a cornerstone of modern cardiology for diagnosing intermittent arrhythmias, heart rhythm problems that come and go, like atrial fibrillation. You wear this small box, connected to electrodes on your chest, for 24 to 72 hours. It continuously records your heart's electrical activity as you go about your daily life, providing a much more comprehensive picture than a standard 10-second EKG in a doctor's office. It's an invaluable tool for catching elusive heart issues that could lead to a stroke if left untreated. The paradox, however, is that the very act of wearing this life-saving device can, for some seniors, create a new set of problems. The issue isn't the device itself, but the impact it can have on one of the most critical pillars of health: sleep. The monitors can be bulky, the wires can get tangled, the electrodes can be itchy or uncomfortable. For many older adults who are already light sleepers, trying to get a restful night's sleep while tethered to a medical device is a significant challenge. When our sleep is chronically disrupted, it sets off a cascade of physiological stress responses. Your body perceives the lack of restorative sleep as a threat and ramps up the production of stress hormones, most notably cortisol. Cortisol is part of our fight-or-flight system. It increases blood sugar for energy, and, importantly, it can raise your blood pressure. A single night of bad sleep can lead to elevated blood pressure the next day. Imagine 2 or 3 consecutive nights of poor sleep while wearing the monitor. This can lead to sustained high blood pressure, particularly dangerous nighttime spikes. For a senior whose arteries may already be narrowed by plaque, these pressure surges can be hazardous. The increased force of the blood pushing against weakened or constricted artery walls can potentially dislodge a piece of plaque, which can then travel to the brain and cause a stroke. Or, the high pressure itself can damage the delicate vessels within the brain. Consider the case of Tom, 66, who was being evaluated for occasional palpitations. After 2 nights of wrestling with his Holter monitor, getting barely any sleep, he felt foggy, lightheaded, and unusually forgetful. While he didn't have a full-blown stroke, subsequent scans showed areas of reduced blood perfusion in his brain, a warning sign that things were headed in the wrong direction, all because of the stress induced by the monitoring process itself. This piece of elderly wisdom is about recognizing the powerful connection between sleep, stress, and cardiovascular health. So, what's our proactive strategy? Communicate with your doctor beforehand. Say, "I'm a very light sleeper and concerned the monitor will disrupt my rest. What are our options?" Inquire about newer technology. The field is advancing rapidly. There are now smaller, wireless patch-style monitors that are far less obtrusive than the traditional Holter with its bundle of wires. Ask if a Zeo patch or a similar device is appropriate for your situation. Discuss the monitoring duration. Ask your cardiologist, is a 24-hour study sufficient, or is the 72-hour period absolutely necessary? They may determine that 1 good day and night of data is enough. Practice good sleep hygiene. On the nights of the study, make your bedroom as comfortable as possible. Ensure it's dark, quiet, and cool. Avoid caffeine and heavy meals in the evening. Try some gentle relaxation techniques before bed. The goal of the Holter monitor is to protect your brain from a stroke, not inadvertently create a pathway to one. By advocating for your comfort and sleep, you ensure the test serves its intended purpose safely. Part 3. The calcium conundrum. Good for bones but risky for arteries. Bone health is, without a doubt, a primary concern for everyone on the senior-wise journey. We hear constantly about the dangers of osteoporosis and the importance of preventing fractures. A key tool in this effort is the DXA scan, or bone density scan. This simple, painless X-ray procedure measures the mineral content of our bones, typically in the hip and spine, to assess our risk of fracture. It's an essential screening for us. The potential trouble doesn't come from the scan itself, which is perfectly safe. It comes from one of the most common recommendations that follows a diagnosis of osteopenia or osteoporosis. Start taking a high-dose calcium supplement. On the surface, this makes perfect sense. Our bones are made of calcium, so if they're weak, we should give them more of their primary building block. However, this is where the calcium conundrum comes into play, a topic of much debate in the medical community. The body's ability to process and direct calcium is incredibly complex. When we get calcium from our diet from sources like dairy, leafy greens, and fortified foods, it's absorbed slowly and naturally, accompanied by a host of other nutrients that help the body use it correctly. High-dose calcium supplements, on the other hand, can flood the system with a large amount of calcium all at once. For an older body, it can be difficult to direct all of that calcium into the bones where it's needed. So, where does the excess go? Unfortunately, it can end up being deposited in soft tissues, including the walls of our arteries. This process, called calcification, contributes to the hardening and narrowing of our blood vessels, the very same atherosclerosis we've been discussing. Furthermore, a sudden spike in blood calcium levels can make the blood itself thicker and more viscous, increasing the risk of tiny clots forming. For a senior, a small clot that might be harmless in a younger person can be enough to block a small, crucial artery in the brain, causing a stroke. Linda's story, a 70-year-old who was diligent about her health, is a cautionary tale. After a DXA scan showed some bone thinning, her doctor recommended a daily 1,200 milligram calcium supplement. A few months later, she suffered a small stroke. Her blood work revealed that her calcium levels were dangerously high. The supplement, intended to strengthen her bones, had instead contributed to the very event she feared. This is a critical piece of senior health tips. How do we build strong bones without endangering our arteries? Get a baseline blood test. Before starting any high-dose supplement, ask your doctor for a blood test to check your current serum calcium levels. You may not need as much as you think. Prioritize dietary calcium. Talk with your doctor or a nutritionist about how to build a calcium-rich diet. This is the body's preferred way of getting this mineral. Question the dosage. If a supplement is deemed necessary, ask, is a lower dose, perhaps 500, 600 milligram, a safer place to start for me? You can supplement your diet rather than replace it. Discuss cofactors. Smart calcium supplementation isn't just about calcium. Ask about vitamin D3, which helps absorb calcium, and vitamin K2, which helps direct calcium to the bones and away from the arteries. This trio works in synergy. Stay hydrated. Drinking plenty of water helps your kidneys flush out excess calcium and keeps your blood from becoming too thick. Navigating bone health is a perfect example of how life health after 60-second requires a nuanced, whole-body approach, not just a single-minded focus on one issue. Part 4. The colonoscopy caution. Another look at sedation and blood flow. The colonoscopy is hailed as the gold standard for colorectal cancer prevention, and for good reason. It allows a doctor to examine the entire length of the colon and remove precancerous polyps on the spot, effectively stopping cancer before it even starts. For those of us over 50, it is one of the most important preventative screenings we can undergo. But just like the endoscopy we discussed earlier, the primary risk for seniors lies in the necessary use of sedation. The process is nearly identical. To ensure the patient is comfortable and still during this lengthy procedure, deep sedation or even general anesthesia is used. And just as before, these powerful medications relax the blood vessels throughout the body, leading to a potential drop in blood pressure. Let's revisit why this is particularly concerning for an older adult. By age 60, 70, or 80, it's not a question of if we have some plaque in our arteries, but how much. The passages that deliver blood to our brain, the carotid and vertebral arteries, may already be somewhat narrowed. Our brain, however, is remarkably adaptive. It gets used to this state, and as long as our blood pressure remains in a stable range, it receives the oxygen it needs to function. The danger zone is the sudden change. When the sedative from a colonoscopy causes a rapid and significant drop in blood pressure, the force pushing blood through those narrowed pipes to the brain can fall below a critical threshold. Think of it like water pressure in an old house with narrow pipes. If the main pressure drops too low, the top floor doesn't get any water. In the same way, the parts of our brain furthest from the main blood supply can become starved of oxygen, leading to an ischemic stroke. George, a 74-year-old man, is a case in point. He was in good health for his age, but had known mild narrowing of his carotid arteries. He went for his routine 10-year colonoscopy. The procedure was a success. A few small polyps were removed, but in the recovery room, he developed slurred speech and confusion. He had suffered a small stroke in a watershed area of his brain, a region vulnerable to drops in blood flow. The trigger was almost certainly the sedation-induced hypotension. This elderly wisdom isn't about avoiding this life-saving cancer screening. It's about making it safer for you. The conversation with your gastroenterologist is key. Full disclosure of your history. Ensure the doctor and the anesthesiologist are fully aware of your entire cardiovascular history. This includes high blood pressure, any known blockages, a history of TIA, mini-strokes, or any previous strokes. Discuss sedation options. Ask directly, given my cardiovascular health, what is the safest sedation plan for me? Are there lighter options that can be used? In some cases, a combination of medications can be used to minimize the impact on blood pressure. Inquire about pre-procedure hydration. The bowel prep for a colonoscopy is dehydrating by design. Dehydration lowers blood volume, which can make a drop in blood pressure even worse. Ask about the best and safest way to stay as hydrated as possible right up until the cutoff time. Explore alternatives if you are at very high risk. For individuals with severe, unstable cardiovascular disease, it's worth asking, what are the pros and cons of a less invasive screening test for me, like a virtual colonoscopy, CT colonography, or a stool-based test like Cologuard? While not as definitive as a colonoscopy, they can be safer options for certain high-risk patients. Your colon health is vital, but so is your brain health. A thoughtful, proactive conversation ensures you are protecting both. Part 5. The blood thinner tightrope. The dangers of hitting pause. Millions of seniors rely on daily blood thinners, medications like aspirin, clopidogrel, Plavix, or anticoagulants like warfarin, Coumadin, Eliquis, or Xarelto. These drugs are lifesavers, preventing the formation of dangerous blood clots in patients with conditions like atrial fibrillation, a history of heart attack, or deep vein thrombosis. They are a shield, protecting the brain from a devastating ischemic stroke. But what happens when you need a dental procedure, like a tooth extraction or a minor surgery? The standard protocol is often to temporarily stop the blood thinner for a few days before the procedure to reduce the risk of excessive bleeding. This seems logical and safe. However, this is where we encounter the perilous rebound effect. Your body is an adaptive machine. When you take a blood thinner every day, your system gets used to this state of reduced clotting ability. When you suddenly withdraw the medication, the body can overcompensate. The platelets in your blood can become hyperreactive, meaning they are suddenly extra sticky and much more prone to clumping together to form a clot. Your blood, in essence, goes from being less likely to clot to being more likely to clot than it was before you ever started the medication. This period of increased clot risk is a window of extreme vulnerability. A study highlighted in the video showed a notable increase in ischemic strokes within just 7 days of stopping anticoagulants. The very act of trying to prevent a bleeding complication from a minor procedure can inadvertently trigger the exact catastrophic event the medication was meant to prevent. Margaret, 68, had been on low-dose aspirin for years for secondary stroke prevention. Her dentist, following standard procedure, told her to stop it 5 days before a tooth extraction. 3 days after stopping the aspirin, she had a TIA, or mini-stroke. Her body's rebound response had created a tiny clot that briefly blocked a vessel in her brain. Walking this tightrope requires impeccable communication and coordination. This is one of the most important senior health tips you can learn. Never stop a blood thinner on your own. The decision to pause this medication must be a coordinated one. Appoint a captain of the ship. Your primary care physician or your cardiologist, whoever prescribed the blood thinner, should be the one to make the final call. The surgeon or dentist will have their preference, but the prescribing doctor understands your underlying clot risk best. Ask precise questions. Don't settle for stop it a few days before. Ask, what is the exact date and time I should take my last dose? And just as importantly, what is the exact date and time I should restart my medication? The restart time is just as critical as the stop time. Discuss bridging therapy. For patients on warfarin or those at very high risk of clotting, doctors may use a short-acting injectable blood thinner, like Lovenox, during the pause. This bridges the gap, keeping you protected while your primary medication is out of your system. Ask if this is an option for you. Confirm communication. Say to your surgeon or dentist, have you spoken directly with my cardiologist, Dr. Smith, about this plan? Don't assume the offices have communicated. Be the catalyst for that conversation. Your blood thinner is your lifeline. Treating any interruption to that therapy with the utmost seriousness and coordination is paramount to your safety. Part 6. The fasting fallacy, when empty means dangerous. Our final topic is perhaps the most common and seemingly benign medical instruction we receive: fasting for a blood test. Nothing to eat or drink after midnight for your labs tomorrow morning. We've all done it countless times. It's necessary for getting an accurate reading on things like cholesterol and blood glucose. For a young, healthy person, it's a minor inconvenience. But for a senior, a prolonged fast can be a hidden hazard. There are two key problems that arise from a 10 to 14-hour fast in an older adult: hypoglycemia and dehydration. First, let's talk about hypoglycemia, or low blood sugar. As we age, our body's ability to regulate blood sugar can become less efficient. Our liver may not release stored glucose as readily. After a long overnight fast, our blood sugar levels can drop lower than is safe. Low blood sugar doesn't just make you feel shaky and weak. It directly affects the brain, which relies on a constant supply of glucose for energy. This can cause dizziness, confusion, blurred vision, and in severe cases, even a blackout, a terrifying prospect, especially if you are driving to the lab. Second, and perhaps more insidiously, is dehydration. The instruction is often nothing to eat or drink, which many people interpret as no water either. Going without fluids for 10+ hours, on top of the natural fluid loss that occurs overnight through breathing, can lead to mild dehydration. When you're dehydrated, the volume of plasma in your blood decreases. This makes your blood thicker, more concentrated, and stickier. The red blood cells and platelets are more likely to clump together. For a senior with pre-existing narrowed arteries, this sludgy blood moves more slowly and is more likely to form a clot, potentially leading to a TIA or a full stroke. Samuel, a 73-year-old man, had a frightening experience that highlights this risk perfectly. He was fasting for routine labs. On his way to the clinic in the morning, he felt lightheaded and blacked out for a few seconds, thankfully managing to pull his car over without an accident. His doctors determined he had experienced a TIA, triggered by the combination of low blood sugar and dehydration from his pre-lab fast. This piece of practical wisdom is crucial for your life health after 62nd. You can make fasting safer with a few simple steps. Question: if the fast is truly necessary. For many routine blood tests, fasting is not required. Ask your doctor, for this specific panel of tests, do I absolutely need to be fasting? Sometimes, only one test in a panel of 10 requires it, and it may not be the most critical one. Clarify the no drinking rule. In almost all cases, you are allowed and encouraged to drink plain water. Confirm this with your doctor's office. I can still drink water, correct? Staying hydrated is your best defense against thick, sticky blood. Schedule wisely. Ask to have your blood drawn at the earliest possible appointment in the morning to minimize the length of your fast. Be prepared. Don't go to the lab empty-handed. Pack a bottle of water and a healthy snack like a piece of fruit, some nuts, or a granola bar to consume the moment your blood has been drawn. Don't wait until you get home. Rehydrating and getting your blood sugar up immediately is key. This simple, proactive approach can turn a routine blood test from a hidden risk into the safe, informative procedure it's meant to be. As we conclude our journey today, the single most important takeaway is not fear, but empowerment. Our bodies after 60 are wise and experienced, but they also have a different set of rules. The standard medical playbook doesn't always account for the unique ways our seasoned systems respond. The 6 scenarios we've discussed, from endoscopy to a simple fasting blood test, are not reasons to avoid medical care. They are invitations to engage with it more deeply. By understanding these potential risks, you are now equipped to ask smarter questions, to advocate for your specific needs, and to partner with your doctors to create the safest possible path to wellness. This is the essence of a senior-wise journey. It's about taking control, honoring your body's wisdom, and actively participating in your own vibrant, healthy future. If you found this information valuable, please help our community grow. Click that like button, share this video with friends and family who could benefit from this knowledge, and most importantly, subscribe to Senior Wise Journey for more content designed to help you thrive in your best years. Thank you for joining us.